March is Colon Cancer Awareness Month, a good time to remember that we need to be as healthy as possible on the inside and out. And colon cancer is one of the few cancers that can be prevented through screening. So to get an idea of what the screening process is like, I went out to a nationally award-winning group, Gastroenterology Associates in Lynchburg. Check it out.
Well, Emily, we're so glad you're here today because March is Colon Cancer Awareness Month. And colon cancer is so real. So many Americans will develop colon cancer. About 5% of Americans will develop colon cancer, so 1 out of 20 people. And if you have a first-degree relative with colon cancer, your risk is actually 15%. If you have 2 first-degree relatives, your risk is actually 25%.
Wow.
Yeah. And so what we're after is finding polyps and getting rid of them. And so we're so happy that you're here today to walk through the colonoscopy process. Let me show you the screen, Emily, because this is what we're after. We want to look at the entire large intestines because what happens is one cell on the lining of the colon develops genetic mutations that make it not want to grow old and die and slough off the way it's supposed to. So in the process, that cell actually develops into a wart-like structure, which we call a polyp. And then as those daughter progeny cells continue to multiply and divide, they may develop more genetic mutations that then make those cells want to start to invade through the wall of the colon and actually start to spread around the body. And that's when that polyp turns into a cancer. So our objective is to find polyps and get rid of them. Never let them turn into a colon cancer. That's what this is all about. Well, Emily, now you're in the pre-op area. We're getting ready for the colonoscopy, and you're with your nurse, Chantel. And of course, yesterday you were on a clear liquid diet all day long, and you went through the bowel prep last night. You drank some solution last night and again this morning that made you go to the bathroom a whole lot. It got you well cleaned out. We want you really well cleaned out for this procedure so that if you have any polyps, we can indeed find them and remove them. Of course, that's what this is all about. We have about 7 different bowel preps, so usually we can find one that people will tolerate fairly well. They're all strong laxatives. Here in this area, Chantel is going to review with you your drug allergies, your medical history, and start an IV, and then we're ready to go.
Now, Chantel, tell me a little bit about the process when folks come in here. You know, are they ever nervous?
Yes, a lot of them are nervous. They've never had a colonoscopy. They're nervous about the sedation. So we're not only asking questions, we're reassuring them that they're going to be okay.
And this really is a pretty fast process. I mean, you know, what is it all like? You know, how long is this all going to take?
They're in prep usually maybe 15 minutes, and then they'll go out for their procedure another 15, 20 minutes, and then recovery another 15, 20 minutes.
So tell me about the next stage here, doctor.
Well, now you're in the procedure room, and we have with us Sandy Fout, who's my assistant. She's going to help me with the equipment, and we have Dr. Steve Scharf, and Steve is our anesthesiologist. Steve's going to be your best friend for the next 20 minutes. Steve is going to give you propofol intravenously, and in about 15 seconds, you'll be asleep. And Steve's going to sit by your side throughout the entire procedure, making sure that you're breathing well, your oxygenation is good, your blood pressure and your pulse are stable, and that you're very comfortable. So we plan to keep you very comfortable throughout this test. If we find or remove polyps, you will not feel that.
Wow, what a crazy thought. So you go in there and you do it all right then and there.
Right. We are going to use this instrument. We're going to use the endoscope, get a good look through the colon, take off any polyps that we find. And as we go, this is a safe test. The risk of this procedure is low. Those would be to have an allergic reaction to a medicine, to have some bleeding from a polypectomy site, or to have the instruments puncture a hole in the colon. But I'm going to be very careful to try to keep any of those things from happening.
And the scope itself, is that have the surgical tools on it itself?
We use surgical tools through the instrument to take off the polyps. Right.
And I want to have a chance to talk to the anesthesiologist as well. You know, what is it like to go under? You know, what's that experience like?
Well, it's a very quick process with the propofol. That's one of the good things about using the propofol is that as soon as we give it, it's just a matter of seconds till you fall into a deep sedation level. So you're totally unaware of the procedure while it's going on. And like Dr. Richards said, we'll be right here at your bedside the whole time. We do have to redose the medication several times during the duration of the examination so that at the end of the procedure, we will stop administering the propofol, and within minutes you will start to wake right back up. And really takes about 10 minutes till you're back to fully wide awake.
That's fascinating that it goes so quickly. Okay, well, let's move on to our next part.
Well, Emily, now you're in the recovery room with your nurse, Jennifer Brown. the propofol will be wearing off very quickly. We expect you to have you ready to go home in 10 to 15 minutes or so. Today you can eat and drink, regular diet, regular drink. We just want you to rest and relax today. Now, one question is, when do we want to come back and do this again? And it will depend completely upon what we found today, what your family history is and what we found today. So depending upon the number of polyps that we found and your family history, we may want to come back in 10 years. We may want to come back in 5 years, 3 years, 1 year. It'll be dependent upon those factors, actually. Jennifer's got a few things that she'd like to tell you about our endoscopy unit.
So tell us about that.
Yes, we're an nationally award-winning accredited unit with the Accreditation Association for Ambulatory Surgery. We are also, first and foremost, our main priority is the patient comfort and safety. And we also are, looking forward to taking care of folks and getting them out back into the community and spreading the word about colon cancer awareness.
And March is Colon Cancer Awareness Month, so get out here and get your colonoscopy, or at least call and plan it.
And Emily, there are a few things that people can do to reduce their risk: a high-fiber diet, exercise, and not be a tobacco product user. Those are probably the 3 most important things an individual can do. And then, well, actually, the most important thing they can do is be screened.
And to learn more about colonoscopies, you can call Gastroenterology Associates of Central Virginia. They're located on Nationwide Drive in Lynchburg, 434-384-1862, and online at gastrocentralva.com.